Hello frenemas, I'm Dr. Jake. I'm a real-life gay doctor and I'm here to clarify medical quandaries and inject your daily dose of queer culture. Today I'm going to be reacting to House MD. I don't usually watch medical shows, so this is going to be a treat. But before I start, these videos take a lot of work, so please like the video, comment, and subscribe to my channel. Help YouTube get more eyeballs on my videos. This episode of House MD gets a little bit dark, so if you're looking for more lighthearted reactions, I'm gonna link a video up above. Oh, and I'm watching Drag Race Season 14 and loving it, so if you have opinions about those queens, I wanna hear. Put it in the comments. It looked like he had a choking episode, so allergic reaction is on my mind as something that could have caused that, but he also could have just had syncope, which is a fancy word for fainting.
This is Dr. House. Aphasia syncope.
He can't speak.
There are many different types of aphasia, but essentially what aphasia means is that you can't talk. Often aphasias are due to stroke, and specifically strokes in the Broca's area and the Wernicke's area. The Broca's area makes your speech sound broken. So the content will still be there, but you just won't be able to form complete sentences. Also with Broca's aphasia, your comprehension is still pretty good. With Wernicke's aphasia, you can form full sentences, but pretty much everything you say is going to be a confabulation, and you lose the ability to really understand language.
There's one thing they didn't test for.
A test for what?
Baking. Ow! Test was positive.
So what he's testing for there, in a rather mean way, is conversion disorder. Conversion disorder is a disease where you have some psychological stressor that has caused your body to stop doing some sort of function. It can be anything. So there are people who have conversion disorder and they're unable to walk. They're unable to use a leg. They're unable to use an arm. They're unable to speak. They're unable to do something that they were previously able to do. Now, the test for conversion disorder usually isn't poking somebody, although maybe if they can't speak, then that's the way to do it. But the archetypal test for conversion disorder in someone who has, say, a limb paralysis is you lift that limb up and then you let it fall. If they don't let it fall to the ground, then you sort of have your diagnosis right there, although there's of course more to do, because if you have conversion disorder, then we have to address that psychological stressor to get it to go away.
What's wrong? Oh my God. Can somebody help us? Please, help out here. Please, hurry. Just breathe. Oh my.
Pleural effusion.
I think his lung is faking it.
A pleural effusion is a collection of fluid in the lung. Pleural effusions can have blood, bile, pus in them. Oh, and by the way, the plural of pus is purulent. I don't want to hear you say P-U-S with an S-Y at the end in the hospital, please. Unless it's literally about a cat.
Check his home for everything else.
He just moved in with his fiancée 3 months ago. Toxic exposure could take longer than that to manifest.
Check his swinging bachelor pad.
That somebody else now lives in.
I assume so.
I have never, as a physician, gone to one of my patients' homes to look for possible toxins. That's a little odd. Now, there are physicians who do home care visits and home health visits, and they may look at things and see what's causing problems, but that's not something that you do when you have a patient in the hospital.
Not the glass. No.
Whoa! 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 Hold up! What? Are they breaking into this person's house? It's not even the patient's house. It's some random person's house that they don't... This is weird. This is weird, man. Never. I feel like it shouldn't be a shock when I say that I've never broken into somebody's house to try to figure out what's going on with the patient.
What the hell?
It's okay. We're doctors. Nobody was home, so we...
Well, I'm calling the police.
Oh, no worries, man. We're doctors. We just broke in. No big deal. Broke your window. It's fine. Everything's fine.
Do you know Ted Taylor? He used to live here.
Actually, he was my boyfriend for 3 years.
Bam.
I'm not gay.
Really? Because it would certainly explain the cold feet.
I think if I had 3 doctors come into a room to interrogate me, even as an out and proud gay man, I'd probably be like, no, it's not me, man. It's not me. No homo, because I would be terrified that they might harm me in some way. As a doctor, when I'm trying to get information from a patient, crucial information for their health, I don't have 3 people in the room. It's just me and the patient. That way I can gain the patient's trust and let them know that I'm not trying to judge them, just trying to help treat their medical illness better.
So, you're bisexual?
No, I'm straight. Cotter, the guy you met, he's gay.
I'm not gay, but my boyfriend is.
I did a lot of stupid things, but I turned my life around. I'm as straight as any of you. You can test me, as long as you don't tell Nicole.
What business is it of hers?
It isn't any business of hers. When a patient tells me that they don't want me to disclose information to a family member or a loved one, I don't, because your privacy as a patient is very important. Not only that, but I could lose my job if I violate your trust. In the United States, HIPAA, which is the Health Information Portability and Accountability Act, prevents me from sharing information with people that are not my patient or my patient's authorized representatives. For this reason, whenever I'm about to share sensitive information like an HIV test result, I will have family members leave the room so that the patient can choose how they want to address it with their family later, or not at all. It's not my business.
I don't see anything wrong with him marrying a straight woman. I'm not saying it's a great choice, just saying it's his choice.
It has to be hers as well, which it can't be as long as she doesn't know he's gay.
It's a little bit weird that they're all saying that he's gay since they don't have that much information about his sexuality yet. He has a fiance and he had sex with a man as well, so presumably he's at the very least bisexual. I don't know why they're going down this route.
You date guys, you date girls. I assume at some point you're gonna make a choice.
Whoa, man. Whoa. At some point, you're going to have to make a choice. She doesn't necessarily have to choose. There are many different types of relationships, and there are many people who aren't interested in relationships and are only interested in casual sex. So let's not assume that she's going to want to be in a monogamous relationship with anyone. For that matter, I get pretty annoyed at the notion that bisexuals have to choose anything. It's just more bisexual erasure. Some bisexual people date men, some bisexual people date women, some bisexual people date both, and some bisexual people date no one. And all of those options should be acknowledged and celebrated, as long as you're honest with your partners.
What you didn't tell us is how you turned your life around.
I talked to some people.
I know this is personal stuff. I'm here to help you, not out you.
I had therapy.
Now that is how you get a patient to trust you and actually tell you what's going on. Let the patient know that you are there to help, to treat their medical illnesses, and not to judge them or out them.
Conversion therapy. Went to a camp for 3 weeks of intensive rehabilitation.
Conversion therapy is, in my opinion, a form of torture, where people try to make gay, bisexual, essentially non-cis hetero people cis-hetero. It doesn't work, and it causes tremendous harm to its victims. Unfortunately, it's practiced in many parts of the United States. I'd love to hear from some of you who aren't from the United States. Have you seen conversion therapy in your country, and how prevalent is it? If you're willing to share, please let me know in the comments. I'd love to read your story. Those who perform conversion therapy should be jailed. One of my favorite doctor YouTubers, Elliot Carthy, has a great video on conversion therapy that I'm going to link to in the description if you want to learn more.
They gave him electroconvulsive therapy to make him straight?
To zap the fabulous right out of him.
Electroconvulsive therapy is a real therapy, and I'm not a psychiatrist, so I can't tell you exactly how it works. Typically, a patient is sedated, and then electric shocks are applied to make the patient have seizures while they're asleep. It's usually used as a treatment for depression that doesn't respond to medications. Psychiatrists, please tell us more about electroconvulsive therapy in the comments.
What are they doing?
An EEG. We're looking for neurological damage that could have caused his symptoms.
Damage from what?
A head trauma?
He had an accident?
It wasn't an accident. It was before he met you.
She has no permission from this patient to talk to his fiance, so this is way out of line. I would not do this. Honestly, what she should be saying is please go talk to your fiance and he can tell you what's going on, so that he can disclose the details that he's comfortable with her knowing.
Spiky.
What's that mean?
I'm not sure. He's coding. Crash car.
What's happening to him?
He's having a heart attack.
Hold up. Number one, coding is not the same thing as a heart attack. A code is when you do not have a heartbeat. Number two, this guy wasn't wearing a cardiac monitor, so how the hell do they know that he's coding? Number three, they didn't check a pulse before they did electrical shocks, and since they don't have him on a cardiac monitor, they don't even know if electric shocks are indicated. There are very specific heart rhythms that require electric shocks, and to know what they are, you have to see the heart rhythm on a heart monitor. I'm not a huge fan of this.
How bad can a night out at a lesbian bar be?
Hey, lesbian bars are fun. For those of you in Chicago, Big Chicks is one of my favorite bars. But I was also a big fan of the Granville Anvil.
I was drunk and confused.
You're gay?
No. I thought I was. I didn't hate the thought of admitting I was gay because I was ashamed. I hated the thought because I wasn't gay. And that was the day I went to get help.
This is heartbreaking. This is something that every LGBTQ person goes through. It is hard for me to watch because I know that pain of not knowing who you are and having to lie to everybody about it. It feels bad.
They cured me, Nicole. That's what all the head trauma is about.
No, ma'am. No, ma'am. You cannot cure someone from being gay because being gay is not an illness. Being trans is not an illness. Being bisexual, pansexual, agender, gender fluid, asexual is not an illness. It is just a part of you that should be celebrated, that should be cherished, that should be nurtured. You can't change who you are, and every person, regardless of their sexual orientation or gender identity, deserves to be treated as a human.
Trust me, she's not straight.
If your gaydar is so great, how come you didn't know about the patient till he met his boyfriend?
Guy walked in with his bride. Took me a while to rotate my dish.
I think many people are under the impression that gay people have better gaydar than our straight counterparts, but what I think it is that we're just always looking for gay people because those are our people. If you're not looking for gay people, you're not going to find them.
To be faithful to his wife, our patient has to deny his identity. Taub just needs to
Resist the biological imperative.
It is easier to say no to dessert than to pretend you don't eat.
That analogy is perhaps one of the best I've ever heard about being gay.
We have sex.
Thank you.
No problems?
Well, there have been some
Nick,
issues.
Erectile dysfunction.
every guy has it sometimes.
I talked about erectile dysfunction in one of my other videos, and I will link it down in the description with a timestamp if I can figure out how to do that.
A penile plethysmograph measures changes in blood flow in your penis. Tells us if there's a circulatory problem.
What's your pleasure?
I feel terrible. I don't think anything's gonna work.
Then we'll have to give you a shot.
Where you don't want to get one.
Shot it is.
Oh my god, I think I would just come out rather than have a shot in my penis if I had a choice. I'm gonna be with him!
Feeling feverish? You're sweating.
What is it?
You're not sweating.
You're lactating.
Whenever a man lactates, it is not normal and is usually the sign that something is wrong hormonally. So the first thing that I think of is a prolactinoma, or a tumor in your brain that secretes prolactin, which is one of the hormones that helps you lactate.
Chiari malformation. Narrowing the base of your skull can cut off CSF flow. But it wasn't a problem until the ECT at breeder boot camp caused your brain to swell just enough to plug the opening. And when your brain pressed up against your pituitary, it signed you up for La Leche League.
This is a little weird because if you were having inflammation from ECT, I'd expect it to be the worst about 3 days after he has ECT and then get better later. But maybe what they're trying to say is that the ECT caused inflammation and then blocked something off, and now he has the problem chronically. I don't know, it's just weird that it only presented on the day of his wedding. I don't really understand.
Proper treatment and surgery will get you in right away.
So, how did I get this thing?
Overbearing mother. Kidding. CM's congenital. Like so many other things, you were born that way.
Hey, at least House understands how homosexuality actually works, that you're born as a gay person.
Really?
I still love you. Do you still love me?
Yes. But
Then that's all that matters.
Get him out! Out! Out!
how can you promise me that?
Because I believe that we get to choose how we live our lives, and I've made my choice.
You get to choose how you live your life, but you cannot choose not to be gay. You cannot choose not to be trans. You cannot choose not to be bi. You cannot choose not to be asexual. All of these things are immutable characteristics that need to be celebrated so that we don't cause depression, anxiety, mental health problems in general. I feel for this guy, but when you lie to your relationship partner, that's a sign that that relationship probably isn't stable.
I want to marry you. I have to marry you.
Too bad. Anyway, that's it. I have a couple of thoughts about this episode. I am really happy that House MD decided to take on this topic. I do have some critiques of how it was done, though. I wish that the characters had taken more of a stand against conversion therapy and actually said something about it. They made it seem like this particular conversion therapy that the patient went through was the only bad one. But all conversion therapy doesn't work and is harmful. In addition, I wish that bi erasure hadn't been a part of this episode. I would have liked to see them actually embrace that people can be attracted to more than one gender. So overall, I'm glad that this content exists, and I'm glad that I have a chance to talk about conversion therapy. And again, check out Elliot Carthy's video on conversion therapy. I just wish that had been a stronger punch of a message. These videos take a lot of work to make, so if you enjoyed it, please subscribe, hit the like button, and come back for more. I want to clarify medical questions about LGBTQ health, and this is how I do it, so get more eyeballs on my videos. I'm Dr. Jake. Goodbye.